Good evening, ladies and gentlemen. I'm Randy Saplina, and I'm here today to talk to the senior class that's about to graduate about the course that they're going to take in order to graduate for their senior year. Today, we're going to talk about cardizem, also known as diltiazem. Cardizem is part of the antidysrhythmic class, or also known as the calcium channel blocker class. Cardizem is used to treat many different heart conditions such as angina, chest pain, hypertension, or SVT, supraventricular tachycardia, and also AFib or flutter. Cardizem helps rate control patients that go into AFib, and that's what we're going to talk about today. The unit that I primarily work on and that the seniors will be on are patients that are post-surgical and traumas, and we see a lot of patients that go into atrial fibrillation after surgeries or stressful events and get put on a cardizem drip. And so we're going to talk about what the students need to know and do if this event happens and what they need to look for. So some goals that the students will need to learn and understand is that the seniors are going to be able to properly determine if patient is an AFib. By this, they're going to be looking at a heart monitor from either the telemetry monitor in the patient's room or the telemetry monitors around the unit. And they will be able to distinguish atrial fibrillation from normal sinus rhythm or some other simple heart rhythms. Seniors will also be able to properly distinguish normal sinus rhythm from AFib also. Seniors will teach family and patients the importance of keeping blood pressure and heart rate within normal range. One of the side effects of cardizem is that it can drop the blood pressure, so students need to be aware of this when patients go on the drip, that it can also drop the blood pressure, so they need to be checking the blood pressure as well. With that, the students will be getting vital signs every 4 hours, or if they notice any acute changes occur, they will let their primary nurse know that they're going to get vitals, and they will let the nurse know what the vitals are so that they can relay them to the doctors and so the doctors know whether the current rate is adequate or if it needs to be increased or decreased. Because a normal starting rate for cardizem on the unit is going to be 10 mLs per hour, and the max is 15 and the lowest is 5. The seniors are also going to be able to titrate the medication with the primary nurse once it sustains normal sinus rhythm for over 6 hours. And that's going to be something that the seniors are going to be able to learn with their primary nurse, but they're going to have to be able to distinguish if the patient has been in normal sinus rhythm for greater than 6 hours. So they're going to have to be watching the monitors and be in communication with the war room, which is also known the telemetry. So some outcomes that the students are going to be able to do is they're going to take a pre-test prior to being able to go to clinicals, and it's going to be what to know about cardizem, and they're going to have to make a 75 or greater before they're even allowed to go to the unit to hang or administer cardizem. Seniors will also be able to teach back information to the lower level students by the end of the semester. This way they have hands-on learning, but they also will be able to teach the students what they have learned, and this is a way for them to actually learn and then teach it back to the students. The seniors will be able to go to a hospital setting, look at a heart monitor, and determine what rhythm the patients are in. At the senior level, we want the patients to be comfortable and be able to read a heart rhythm and to be somewhat confident in what they're reading. Not everybody's going to be fully confident in heart rhythms because that's not going to be what floor they go on. But we want them to be able to distinguish between normal sinus rhythm and AFib, and we will teach them what they need to know and what to look for. AFib can be kind of tricky, so that's what we're going to test them for and show them the differences in AFib. Students will be able to administer oral cardizem to patients who have transitioned from IV drip to oral to 3 patients by the end of the semester successfully, and be able to discuss the side effects. So once the patient has maintained normal sinus rhythm, then they're going to be transitioned to either cardizem, low pressor, or some other beta blocker to keep their heart rate at normal sinus rhythm, and we want the students to be able to help administer these meds, and we want them to be able to talk to the family and tell the family what meds they're getting and why they're getting these meds. The seniors will also learn how to hang the IV cardizem and whether it needs to be piggybacked or hung primary. And so the students will be able to teach us how to do this by the end of the first week because we want them to learn early on. So some tasks that the students are going to be learning is how to demonstrate how to pass the what to know cardizem quiz, how to demonstrate how to hang the IV cardizem with secondary fluids. The students will demonstrate how to properly titrate the medication. So like I said earlier, it's going to start at 10 mLs per hour, but if the patient is tolerating and maintaining normal sinus rhythm, then we're going to drop it to 5. But if the patient's not and we need to bump it up to 15, the students need to know when the proper time is to escalate that and to titrate it up. And then the student will demonstrate how to properly give the oral medications and talk to the family and educate the family and the patient on what the oral medication is for. Some other evidence is the student will demonstrate how to teach family the side effects. They're going to have weekly worksheets and online modules to advance their knowledge about cardizem. So this class is going to be a primarily in-person and clinical class. No books are going to be needed as it's going to be taught using PowerPoint modules, online articles, quizzes, and clinical settings. This class you'll be able to use work computers to do all of your stuff because we want to be there to help you and answer any questions you might have. And so this way, if you need anything, we are right there to help you. And also, you will take the quiz on week 1, which is going to be the introduction, your pretest, and you must maintain a 75 or greater to be able to move into the clinical setting. This is a 3 to 4 week class, and each week you're going to learn more and more about cardizem. Week 2, you're going to learn about medications, and then the transition from cardizem onto either oral cardizem or low pressor. Week 3, you're going to learn what to know. And then week 4, you're going to take a post-test about cardizem. But on week 4, you have to maintain 100% to pass the class. We will teach you everything you need to know in order to pass and make 100 on this exam. So you have to make 100 in order to stay and pass the class. So like I said earlier, cardizem is given to patients after they have a big surgery and their heart doesn't react to this stressful situation. And so their heart goes into atrial fibrillation. And so they're put on this medication for rate control. So this is the thing that we need to teach the students so that they know that why the patient's on it, how long they're going to be on it, and what they're going to do once they're off of this medication. So for closing activities, I'm going to have the students go over the importance of cardizem because we can't ever stress how important this medication is. Also verbalize the therapeutic communication because some patients aren't going to understand why they're on this medication and what it's doing for them. You're always going to have the difficult patients that want to refuse medications, and they need to know that this medication is going to help them and that they need to be on it. So I want to teach the students that there are going to be some patients that refuse, and I want them to know how to handle difficult patients. So we will talk about therapeutic communications for this type of patients. And again, they will take the post quiz and they will need to make 100 on it. And any other questions that they have, they will be able to ask the faculty, as this is an online or in class, and any questions they have, they will be able to ask because we will be there along the way. So that is all I have for you today. If you have any further questions, please let me know, and I will be glad to help you, and I hope that you learn everything that you need to know about cardizem. Thank you, and have a great evening.